Welcome to Secrets of Nursing Homes, giving you a sneak peek of the hidden underbelly of nursing homes. This is a final video in the first chapter about staffing. Today I will focus on ancillary staff, beginning with the big three: occupational, physical, and respiratory therapist. Occupational therapists help patients learn to live with their disabilities by supplying such things as wheelchairs, walkers, raised toilet seats, reaching devices, and shoehorns, as well as training. Physical therapists aim to increase and restore mobility and to reduce pain. They decrease accidents or help restore stability after a fall. Respiratory therapists focus on airways and breathing treatments. In a lot of facilities, respiratory care therapists may only come in weekly or when called. The rest of the time, the nurses will be taking care of you. Top priority is to keep patients in their best respiratory status. The question is the proper amounts of therapy given in the proper way? Therapists are limited to time and money allocated. When the therapists are gone, either the nurse or the aide will follow the guidelines of care, including taking over minor roles like walking and range of motion. A gait belt should be used for transferring or walking patients. You may be walked without a gait belt or hurried along because of reduced staffing. If you refuse treatments, no one is going to try to encourage you to do it again. They just mark it off as refused and move on to the next patient. Not enough time, not enough staff. There are many departments in a nursing home. They are the staff. They do the laundry, cook the meals, clean up, and mow the lawn. Most of these people will never be allowed into your room, and you may never even see them. However, their role is critical to the facility. You will know if they do a poor job, as your day-to-day life will suffer. Some of the departments in the facility are the janitorial, maintenance, office, dietary, and laundry. Here are some of the things which could go wrong when these departments aren't doing their job properly. Broken machines, stained and missing laundry, cheap food prepared the way the cook likes it, not the residents, bugs, dirty and dusty common areas, scratched areas in disrepair, not enough personal products, or not enough nursing supplies. Staff is anyone authorized to work in the facility from an outside source, whether medically or non-medically related. Most of the ancillary staff have a highly specialized skill, such as X-ray technician or IV placement and pest control or maintenance. These workers should be friendly and courteous to guests and families and knowledgeable about their jobs. Certified nursing assistants brought in from another company filling staffing needs may not be facility trained, having their own ideas and shortcuts. They are under the supervision of the floor nurse. X-ray technicians need to understand pain and to be able to verify placements of differing lines placed in veins or body cavities. They do X-rays of bones as well as confirm placements of implanted and inserted devices. IV nurses will place these lines. A normal IV line called a peripheral line. Midlines is a longer, heavier duty line. Peripheral inserted central catheter lines for more heavy-duty meds, and subcutaneous infusions that are not placed into veins but under the skin. Pest control checks out written complaints and carries out scheduled rounds. Hopefully there won't be any critters or pests to deal with, but if you do see something, tell the nurse promptly. IT and electrical technicians, they will upkeep phones and computers. And then carpet cleaning people will clean carpets using specially formulated solutions to disinfect, discourage pests, and keep the carpet from becoming a slip hazard. This is the end of Chapter 1. Stay tuned for Chapter 2 about assessments done correctly and what can go wrong. Thank you for watching. If you like us, please subscribe and pass it on. Consider becoming a Patreon to help us pass this information on to people who really need this. Thank you so much.